Hi there. Think you're good at NCLEX prioritization questions? These 25 questions catch a lot of nursing students. I'll give you each question, then break down why one answer comes first. Keep your score and see if you can get 20 out of 25. Are you ready? Let's start. So, question number one. A school-age child falls from his bicycle after striking a curb on the way to school. He reports severe pain in his lower leg and says he thinks the leg may be broken. He is alert, breathing normally, and unable to bear weight on the affected leg. Which action should the school nurse take first? Letter A. Apply a splint to the injured leg and instruct the child to remain still. Letter B. Ask the child to describe how the fall occurred. Letter C. Position the child in semi-Fowler's position while awaiting further evaluation. Or letter D. Assess the injured leg for deformity, swelling, skin changes, and bleeding. Pause the video, review the question and the four choices, and when you're ready, come back to find the correct answer. The correct answer is letter D. The main reason why letter D is the correct answer because assessment comes before intervention when the child is stable. Determine neurovascular and injury status before splinting. Letter A is incorrect because splinting comes after assessment. Letter B is also incorrect because mechanism is important but not the immediate priority. And letter C is incorrect because semi-Fowler's does not address the injury. So A, B, and C are incorrect. Next question. A child with bipolar 1 disorder is admitted to an inpatient psychiatric unit after police found her attempting to climb a construction crane because she believed she could see the entire city from the top. Her family reports that she has slept less than 2 hours over the past 2 nights, has eaten very little, and has missed several doses of lithium. During admission, she paces continuously, speaks rapidly, and moves from one activity to another without completing any of them. She repeatedly attempts to leave the unit despite staff redirection. Which nursing intervention should receive the highest priority? So our choices, letter A, review the purpose of lithium therapy and reinforce medication adherence. Letter B, place the client in a low stimulation environment, remove potential hazards, and provide close observation. Letter C, offer high-calorie finger foods and establish scheduled periods for rest. Or letter D, set clear limits regarding intrusive and disruptive behaviors. Again, pause the video, review the question and the four choices. The correct answer is letter B. The client is acutely manic with unsafe behavior. Immediate safety and injury prevention take priority. Letter A is incorrect because medication teaching can occur after stabilization. Letter C is also incorrect. Nutrition and rest are important but secondary to safety. And letter D is also incorrect because limits are needed but immediate physical safety comes first. Let's go to the next question. Our next question. A 41-year-old client is receiving or recovering after surgery that resulted in a new colostomy. The stoma is pink and moist, and the client has begun participating in routine post-operative care. During discharge planning, the client states that he is unsure how to manage the pouching system, protect the surrounding skin, and recognize complications after going home. Which referral should the nurse prioritize? Couple of options. Letter A, wound, ostomy, and continence nurse. Letter B, social worker. Letter C, physical therapies. Or letter D, occupational therapy. Pause the video, review the question and the four choices. When you're ready, come back to find the correct answer. So the correct answer is letter A. A wound, ostomy, and continence nurse specializes in ostomy care, pouching, skin protection, and complication prevention. Letter B is not correct because social work focuses on resources and discharge needs. Letter C is incorrect because physical therapy focuses on mobility. And letter D is also incorrect because OT focuses on functional activities. Our next question. An older adult with a recent stroke and a history of dementia is admitted to the medical unit. The client has left-sided weakness, becomes disoriented to place, and repeatedly attempts to get out of bed without assistance. The client requires help with bathing and transfers, but is able to follow simple commands. Which nursing problem should receive the highest priority? Let's look at our option. Letter A, self-care deficit related to bathing and hygiene. Letter B, risk for injury related to impaired cognition and mobility. Letter C, impaired physical mobility related to left-sided weakness. Or letter D, chronic confusion related to cognitive impairment. Pause the video, review the question and the answers. The priority here is letter B. Repeated attempts to get out of bed combined with weaknesses and confusion create an immediate fall and injury risk. That's the reason why that's the correct answer. Letter A is incorrect because self-deficit is not immediately dangerous. Letter C is also incorrect because mobility impairment is important, but safety takes priority. And letter D is also incorrect because confusion is chronic and not the immediate threat. Let's go to the next question. Question number 5. A client with an intestinal obstruction has a nasogastric tube connected to low intermittent suction for gastric decompression. 2 hours later, the client vomits approximately 200 ml and the nurse encounters resistance when attempting to flush the NG tube. Which action should the nurse take first? Is it going to be letter A, remove the NG tube and insert a larger bore tube? Letter B, reposition the client onto the left side. Letter C, change the suction setting from intermittent to continuous. Or letter D, apply additional pressure to continue flushing the tube. Pause the video. The correct answer is going to be letter B. Vomiting and resistance suggests inadequate NG drainage. Repositioning may improve tube position and drainage without forcing the tube. Letter A is not the correct answer because replacement is not the first intervention. Letter C is also not the correct answer because continuous suction can injure gastric mucosa, while letter D is also not correct because we never force irrigation against resistance. Our next question. Let's go to question number 6. The nurse receives handoff on 4 clients at the beginning of the shift. One client has a laboratory result that may indicate immediate threat to cardiac function. Which client should the nurse assess first? Is it letter A, a 36-year-old client receiving chemotherapy for lymphoma with a serum potassium level of 7.5? Is it letter B, a 22-year-old with sickle cell disease reporting generalized pain, rated 6 out of 10? Is it letter C, a 58-year-old client with ovarian cancer who has completed discharge teaching and is awaiting transportation home? Or letter D, a 74-year-old client with chronic obstructive pulmonary disease whose oxygen saturation is 96 on room air? Pause the video again. So the correct answer here is going to be letter A. So severe hyperkalemia can cause fatal cardiac dysrhythmias and requires immediate assistance. Letter B is not correct because pain requires treatment but is not immediately life-threatening. Letter C is also incorrect because client is stable and waiting for discharge. And letter D is also incorrect because oxygen saturation of 96% is very acceptable in a COPD patient. Let's go to the next question. The nurse plans to delegate showering assistance for an older adult who uses a wheelchair to unlicensed assisted personnel or UAP. The client is clinically stable and requires help with transfers and personal hygiene. Before assigning this task, which information should the nurse verify first? Is it letter A, the UAP will remain under direct observation while completing the shower? Letter B, the UAP has demonstrated competency in safely performing the assigned task. Letter C, the UAP has previously assisted another client with showering. Or letter D, the task was discussed with the UAP during the shift report. Pause the video. The best answer is going to be letter B. The nurse must ensure that the UAP is competent to safely perform the delegated task. Letter A is not the correct answer because direct observation is not routinely required. Letter C is also not the correct answer because previous experience does not prove competency. And letter D, discussing the task does not establish competency. Let's go to the next question. Question number 8. A prominent public figure is admitted to an outpatient surgical unit for a scheduled procedure. The nurse observes a hospital employee who is not involved in the client's care, reviewing the electronic health record. What action or which action should the nurse take first? Is it A, allow the employee to continue because hospital staff have access to the electronic record? Letter B, instruct the employee to stop accessing the record because there is no care related needed for the information. Letter C, inform the client that an authorized employee has reviewed the medical record. And letter D, contact the healthcare provider to determine whether the employee may review the record. Again, pause the video and review the choices. For this question, the best answer is going to be letter B. Employees may access health information only when needed for their job or the client's care. A is incorrect. Employment does not permit unrestricted access. C is also incorrect. Stop the privacy breach first. And letter D is also incorrect. Provider permission does not authorize unnecessary access. Let's go to the next question. During the evening medical pass, the nurse prepares to administer several scheduled medications, including an anticoagulant. The client is awake and able to participate in the identification process. Before administering any medication, which action should the nurse take first? So is it letter A, scan the medication package and the barcode on the client's identification band? Letter B, ask the client to state only the full name listed on the medication record. Letter C, compare the client's full name and date of birth on the identification band with the medication administration record. Or letter D, verify the client's full name and assign room number with the medication administration record. Pause the video. For this question, the correct answer is letter C. Medication administration requires at least 2 approved client identifiers. Letter A is not the correct answer because barcode scanning does not replace proper identification. B is also incorrect because name alone is only one identifier. And letter D is also incorrect because room number is not an acceptable identifier. Let's go to our question number 10. A client with chronic heart failure is scheduled to receive digoxin 0.125 milligrams orally. Before administration, the nurse auscultates the apical pulse for 1 full minute and obtains a rate of 56 beats per minute. The client denies dizziness, chest pain, or shortness of breath. Which action should the nurse take first? A. Administer the digoxin and reassess the apical pulse in 1 hour. B. Hold the digoxin and notify the healthcare provider. Letter C. Obtain a 12-lead EKG before deciding whether to administer the medication. And letter D. Obtain a serum digoxin level and administer the medication while awaiting the result. Pause the video. You got it right if you chose letter B. An adult apical pulse below or less than 60 beats per minute generally requires withholding digoxin and further evaluation. Letter A is incorrect. Giving digoxin could worsen the bradycardia. Letter C is also incorrect. An ECG may follow, but hold the medication first. Letter D is also incorrect because here, do not administer while awaiting a result of the digoxin level. Let's go to the next question. Question 11. A 36-year-old primary gravidator with pre-gestational diabetes is administered with a diagnosis of preeclampsia. She is alert and denies visual disturbances or epigastric pain. Which nursing action should be performed first? Letter A. Administer low-dose aspirin as prescribed. Letter B. Request an order for calcium supplementation. Letter C. Assess and monitor the client's blood pressure. Or letter D. Begin preparations for immediate delivery. Pause the video. The correct answer and the best answer here is letter C. Hypertension is a defining feature of preeclampsia, and current severity must be assessed before other interventions are done. Letter A is incorrect because aspirin is mainly preventive, not acute treatment. Letter B is not correct because calcium is not the immediate priority. And letter D is also incorrect because immediate delivery is not indicated from the information given in the stem. Let's go to question number 12. Okay, question 12. A client is 2 days post-op following abdominal surgery and calls the nurse after coughing forcefully. The client reports feeling sudden pulling sensations, and the nurse observes separation of the surgical wound edges. Which action should the nurse take first? Let's look at the options that we have. A. Remain with the client while another staff member notifies the healthcare provider. B. Position the client with the head of the bed slightly elevated and the knees flexed. Letter C. Cover the incision with warm, sterile saline soap dressings. Or letter D. Assist the client into an upright sitting position to decrease further coughing. Pause the video again. The correct answer for this question is going to be letter B. This position decreases abdominal tension and reduces further separation of the wound. Remember, it's an abdominal surgery. Letter A is not correct. The provider should be notified but first protect the wound. Letter C is also not correct. Moist sterile dressings are appropriate, but again, repositioning is the number one priority. Letter D, upright positioning increases abdominal tension, hence that is not the correct answer. Let's go to question number 13. So question number 13, a hospitalized client suddenly develops generalized tonic-clonic seizure or lying in the bed. The client has rhythmic jerking of the extremities and is not responsive to verbal commands. Which action should the nurse take first? Let's look at our option. A, assess the client's respiratory status during the seizure activity. B, clear nearby objects and protect the client from injury. Letter C, insert a padded oral airway to maintain tongue position. Or letter D, hold the client's extremities to prevent excessive movement. Pause the video. The correct answer is letter B. During an active seizure, the immediate priority is preventing injury while allowing the seizure to run its course. A is not correct. Respirations are assessed, but safety comes first during active movement. C is also not correct. Never insert anything into the mouth. And D is also not correct. Never restrain the extremities. Next question. An 82-year-old client with rapid atrial fibrillation is receiving continuous telemetry monitoring. 2 hours after admission, the monitor alarms indicates a rhythm that appears to be ventricular tachycardia. The client's current condition is not yet known. Which action should the nurse take first? Is it A, activate the emergency response team immediately? Letter B, silence the monitor alarm and adjust alarm parameters? Letter C, notify the healthcare provider of the apparent rhythm change? Or letter D, assess the client and verify the placement and connection of the telemetry leads? Stop. Pause the video. So the correct answer is letter D. Treat the client, not the monitor. Determine whether the rhythm is real and assess hemodynamic status first. Letter A is not the best answer because emergency response depends on the client's condition. Letter B is also not correct because you do not simply silence a potentially serious alarm. Or letter D, notify the healthcare provider of the apparent rhythm change is not correct because assessment before calling the provider is very important. Let's go to the next question. Question 15. A client is 6 days post-op following abdominal surgery and has a large midline incision. While performing coughing and deep breathing exercises, the client reports sudden popping sensation and the nurse observes abdominal tension protruding through the incision. Which action should the nurse take first? A, reassure the client that this can occur during normal wound healing. Letter B, notify the surgeon immediately and await for further instruction. Letter C, cover the exposed tissue with sterile dressings, moisten with saline or sterile normal saline. And letter D, apply an abdominal binder and place the client in a semi-Fowler's position. Pause the video. The correct answer for this question is letter C. This is evisceration. Protect exposed organs from dying and contamination immediately. Letter A is incorrect because evisceration is never normal healing. Letter B, notification the surgeon after protecting the tissue is necessary. Letter D is also incorrect. Never apply pressure with an abdominal binder. Let's go to the next question. A 52-year-old client with an acute gastrointestinal bleed is receiving the first unit of PAC-RBC for hemoglobin at 6.8. 15 minutes after the transfusion begins, The client develops chills, shortness of breath, and severe lower back pain. Which action should the nurse take first? A. Obtain a complete set of vital signs and notify the health provider. B. Reduce the transfusion rate and reassess the client in 15 minutes. C. Stop the blood transfusion immediately and maintain IV access with normal saline using a new tubing. Or letter D. Administer prescribed analgesia, apply oxygen, and provide additional blankets. Pause the video. So definitely the correct answer is letter C, right? Chills, dyspnea, and severe back pain suggest an acute transfusion reaction. Stop the blood immediately. This is not correct. Letter A is not correct. Vital signs and notification follow after stopping the blood. B is also not correct. Do not merely slow a suspected reaction. And letter D is also not correct because symptom treatment does not remove the cause. Let's go to the next question. The nurse received shifts report on 4 newborns in nursery. All infants were born at term and have had an uncomplicated transition after birth. Which newborn should the nurse assess first? Letter A, a 2-day-old newborn who is quietly alert with a heart rate of 185. A 1-day newborn who has a temporarily bulging anterior fontanelle while crying. C, a 12-hour-old newborn with irregular respirations at 45 breaths per minute while being held. Or letter D, a 5-hour-old sleeping newborn with bluish discolorations of both hands and feet. Pause the video. The correct answer is going to be letter A. A sustained heart rate of 185 while calm is abnormal tachycardia and requires assessment. Letter A is incorrect because bulging fontanelle while crying can be transient. Letter C is also incorrect because irregular respiration can be normal in newborns. And letter D is also incorrect because acrocyanosis is common shortly after birth. Let's go to the next question. Okay, number 18. The nurse receives report on 4 post-operative clients at the beginning of the shift. One client has a finding that may indicate developing complication and requires prompt assessment. Which client should the nurse see first? Let's do it. A 35-year-old client admitted 3 hours ago after a gunshot wound with a 1.5 cm area of dark drainage on the dressing. Letter B, a 43-year-old client who is 2 days post-op from a mastectomy with 23 ml of serous sanguine strain on the JP drain. Letter C, a 59-year-old client with a chest tube following traumatic pneumothorax who has had no drainage during the past 8 hours. Or letter D, a 62-year-old client who is 3 days post-op after an abdominal peritoneal resection and now reports chills. Pause the video. So the correct answer is letter D. So new chills may indicate infection or developing sepsis and requires prompt assessment. Letter A is definitely incorrect. A small amount of drainage can be expected. Letter B is also incorrect because small serous sanguine strain at the JP drainage is expected. And letter C is also incorrect. Lack of chest tube drainage alone does not necessarily indicate deterioration. Let's go to question number 19. Question number 19. A client with end-stage kidney disease is scheduled to begin peritoneal dialysis. The nurse has verified the prescription and is preparing for equipment before the dialysate is instilled. Which action should the nurse take first? So let's look at it. A. Assess the vascular access for the presence of prurient trill. Letter B. Warm the prescribed dialysis solution to body temperature. Letter C. Position the client on the left side before beginning the exchange. Or letter D. Insert an indwelling urinary catheter before instilling the dialysate. Pause the video. The best answer is going to be letter B. Peritoneal dialysis should be warm to promote comfort and peritoneal blood flow. Letter A is not the correct answer because Bruentril apply to hemodialysis vascular access. Letter C is also incorrect. Like left-sided positioning is unnecessary. And letter D is also incorrect because a urinary catheter is not routinely required for this scenario. Let's go to the next question. The nurse receives shift report on 4 clients and begins making initial rounds. All 4 clients were reported as hemodynamically stable during handoff. Which client should the nurse assess first? Let's do it. Letter A, a 14-year-old client experiencing a sickle cell pain crisis whose peripheral IV has infiltrated. Letter B, a 59-year-old client with leukemia who is currently receiving a packed RBC transfusion and received approximately half of the unit. Letter C, a 68-year-old client who is scheduled for bronchoscopy later in the morning. Or letter D, a 74-year-old client who reports that the colostomy pouch is leaking. Pause the video. So the best answer and the correct answer here is going to be letter B. Transfusion reactions can develop rapidly, so a client actively receiving blood requires priority for surveillance. Letter A is not correct. The infiltrated IV needs replacement, but it's not the highest priority. Letter C is also not correct. Bronchoscopy preparation can wait. And letter D is definitely not correct. A leaking ostomy pouch is not immediately life-threatening. Let's go to the next question. Question 21. A client with cervical cancer is receiving intracavitary brachytherapy with a sealed radioactive implant. During the care, the nurse discovers that the radioactive source has become dislodged from its prescribed position. Which action should the nurse take first? Letter A, use sterile hemostats to return the radioactive source to the treatment site. Letter B, cover the radioactive source with a blanket and move it away from the client. Letter C, use long-handled forceps to place the radioactive source into the designated lead-lined container. And letter D, obtain a radiation exposure reading on the client before notifying the radiation safety team. Pause the video and review the choices. The correct answer is letter C. A dislodged brachytherapy source must be handled with long forceps and placed in the designated radiation container. Letter A is not correct. Never handle or reinsert the source directly. Letter B is incorrect. A blanket does not provide adequate radiation shield. Or letter D is not correct. Secure the source before further assessment. Let's go to question number 22. Question 22. The emergency department nurse reserves 4 newly admitted clients within a short period. Each client requires evaluation and treatment. Which client should the nurse assess first? So is it going to be letter A, a client with persistent chest pain that has not improved after nitroglycerin? Letter B, a client with full thickness burns involving the face and the neck? Letter C, a client with a confirmed left hip fracture and severe pain? Or letter D, a client reporting a new onset epigastric pain? Pause the video. The best answer is going to be letter A. Facial and neck burns create a risk for rapid progressing airway edema, so airway takes priority. Letter A is incorrect. Persistent chest pain is urgent, but airway threat takes priority. Letter C, hip fracture. C is also incorrect because hip fracture is painful, but usually not immediately life-threatening. Or letter D is also incorrect because epigastric discomfort requires evaluation but is a lower priority. Let's go to question number 23. A home health nurse is preparing to perform chest physiotherapy for an older adult with COPD and increased respiratory secretions. The client is alert and able to follow instruction. Which action should the nurse take first? A. Schedule the treatment before meals to reduce the risk of nausea and aspiration. B. Auscultate the client's lung fields before beginning the treatment. C. Administer the prescribed bronchodilator after completing chest physiotherapy. Or letter D. Percuss the affected lung segments before instructing the client to cough. Pause the video again. So the best answer here is going to be letter B. Assess respiratory status before chest physiotherapy so the nurse can identify affected areas and evaluate response afterwards. Letter A. Timing before meal is appropriate but not the first bedside action. Letter C is incorrect. Bronchodilators are generally more useful before the therapy. And letter D is also incorrect because assessment precedes percussion. Let's go to question number 24. The nurse is inserting a peripheral IV catheter into the client's left arm. During advancement of the catheter, the client reports a sharp electric shock sensation radiating down the arm into the hand. Which action should the nurse take first? A. Ask the client to take slow deep breaths while the catheter is advanced. B. Stop the insertion and remove the needle and catheter immediately. Letter C. Reassure the client that this sensation is expected during IV insertion. Or letter D. Withdraw the needle slightly and attempt to redirect it again. Pause the video. Correct answer is going to be letter B. So an electric shock sensation suggests contact with or injury to a nerve. Stop immediately. Letter A is not correct. Continuing could worsen nerve injury. Letter C is not correct. This sensation is not expected. Letter D is also incorrect. Do not redirect near a nerve. Let's go to our last question. A client receives 10 units of MPH insulin every morning at 8 a.m. At 4 p.m., the nurse finds the client's diaphoretic, shaky, and mildly confused. Which action should the nurse take first? A. Check the client's vital signs and reassess in 15 minutes. B. Test the urine for glucose and ketones. Letter C. Give 15 grams of rapid-acting carbohydrates such as 4 ounces of fruit juice. Or letter D. Notify the healthcare provider before initiating the treatment. Pause the video. So letter C is the correct answer, right? Diaphoresis, tremors, and confusion around the peak action of MPH strongly suggests symptomatic hypoglycemia. Treat the symptoms immediately if the client cannot swallow. Letter A is incorrect. Do not delay treatment for vital signs. Letter B is also incorrect. Urine testing does not rapidly confirm hypoglycemia. And letter D is incorrect because treatment should not wait for provider notification. So how did you do? Let us know in the comments how many answers you got it right. Remember, you can do it.